students, it is of a great pleasure to welcome you all for today's lesson, where we'll be looking at the disorders that affects the pancreas. Pay a particular attention for you to understand much on number of disorders that we are going to discuss in this unit for today. And before we talk about the disorders that affects the pancreas, the first thing we'd like to talk about the anatomy of the pancreas. Where do we find the pancreas and what's the structure of the pancreas? So here we're saying that the pancreas is a pale gray gland weighing about 60 grams, and it is about 12 to 15 centimeters long and is situated in the epigastric and the left hypochondriac region of the abdominal cavity. So in this case, first thing that you need to understand is that the location of the pancreas, the head of the pancreas is going to be found within the epigastric, which is the middle upper quadrant of the abdominal cavity, and its body and the tail or the pancreas, it is found in the left hypochondriac region, which is actually the upper left part of the abdominal cavity. And we're saying that this pancreas consists of three parts. There is what we call the head, the body, and the narrow tail. So looking at the diagram here below, it is showing those segments that we're talking about. So we can see that there's a head which actually joins to the duodenum, and there's a body, and there's also a tail, and the associated structures to the pancreas, there's the duodenum and the bile duct, as we have already seen on this visual aid. So having this in mind, we are going to talk about a number of disorders that actually affects the pancreas, as it has already been shown. So now we're saying that the head, it lies in the cave of the duodenum, just like we have already demonstrated, behind the stomach, and the body is going to be found behind the stomach, and the tail, it lies just in front of the kidney, and it reaches up to the level of the spleen. So the abdominal aorta and the inferior vena cava lie behind the pancreas. And the other thing that you need to understand is that apart from the structure that we've already mentioned, is that this pancreas actually, it has two functions that it plays in the body. First, it acts as an exocrine gland. Secondly, it also works as an endocrine gland. When we say exocrine gland, these are the glands that actually secretes their hormones into the ducts or the lobules or the tubes. And when you say the endocrine glands, these are the glands that do not have the ducts, are actually said to be the ductless glands, and rather they secrete their hormones into the blood, and as it is being distributed within the blood, it actually targets the cells within the specific receptor site for the particular hormone. So now, how does it work in both exocrine and endocrine? Look at this. The exocrine pancreas, we are going to talk about its part of exocrine. What you need to understand by this, it has the lobules that actually made up of the small alveoli, and they consist of secretory cells. And all these lobules, when you are grouped together, they join up to form what we call the pancreatic duct. So if you've noticed in the diagram that we have just shown earlier, it had the pancreatic duct in between. Never mind, we are going to show it. So with this pancreatic duct, it actually opens in the duodenum, where it empties its contents to work in the digestive system. So when it comes to the digestive system, the pancreas is an exocrine gland. So we're saying that just before entering the duodenum, the pancreatic duct, it joins with the common bile duct to form what we call hepatopancreatic ampulla. Keep in mind about this relationship between the bile duct and the pancreatic duct, because it is going to help us as we are going further. So they join to form what we call hepatopancreatic ampulla, and the function of the exocrine pancreas is to produce the pancreatic juice into the duodenum, which actually contains the enzymes that are essential in the digestion of carbohydrates, proteins, and the fats. So we are saying that in the digestive system, it has the function of exocrine, where it secretes pancreatic juice through the pancreatic duct to the digestive system. What of when it comes to the endocrine? This pancreas, when it comes to endocrine, it contains the specialized cells that we call pancreatic islets. These pancreatic islets, they do not have the ducts where they release their hormones into. And the hormones that are secreted through this part of the endocrine part of the pancreas, there's insulin and a glucagon, which is directly distributed into the blood. Insulin, it actually helps to lower the levels of the sugar by increasing the cell uptake of the glucose that can be found within the bloodstream, and also to ensure or enables the conversion of glucose into glycogen so as to be stored within the liver. And the glucagon is just the hormone that is released from the islet cells or the pancreas, specifically in the islet cells of the pancreas, which actually functions in breaking down all the glycogen stored in the liver so as it to ensure or to elevate the levels of glucose within the bloodstream for the cell use. So that's why we are saying it has both parts in exocrine and also endocrine. So one of the disorder that we are going to talk about for today, which actually affects the pancreas, it is the rupture of the pancreas. Rupture of the pancreas, in this case, sometimes it may be difficult to discover, more especially if at all it is not that severe so as to produce some signs and symptoms, and so it mostly can be found during the surgical exploration, whereby the surgical procedure is done so as just to review or to examine the organs of the abdomen to rule for any abnormalities that can be causing some damage, but not primarily that the diagnosis is specifically on the pancreas, but it can be found during that surgical exploration. And what could be the cause of the rupture or the pancreas? In this case, the cause can be of different substances or the different objects. The blunt objects can cause that, like a localized blow to the mid-abdomen to target the pancreas. It can lead to wrist rupture. I understand that the pancreas injury has high mortality rate. And also, when this pancreas gets to be ruptured, it usually going to affect the duodenum and also the biliary tract, causing the injuries to these all structures. Why? Remember the relationship that is there between the pancreas and also the biliary tract and the duodenum. Another cause could be the penetrating abdominal injuries. For example, let's give an example of a knife. When the knife penetrates through the abdomen and targets the pancreas and pierces it through, it can lead to the rupture of the pancreas. So these are what we are talking about. What are the possible signs and symptoms that can rule for the presence of the rupture of the pancreas? We can have the vague upper and mid abdominal pain that radiates to the back. Why is it like this? Because we have talked about the location of the pancreas of having been found in the epigastric and also left hypochondriac region, which is actually the upper part of the abdomen. So it can be localized pain due to the inflammatory process that can be happening as a result of an injury. And we can also see the generalized peritoneal irritation that leads to pancreatitis, just like we have already mentioned. And there can be epigastric pain. Epigastric pain just denoting the rupture. Maybe it could be on the head or the pancreas that has been ruptured. Hence, the pain will be localized at the epigastric region. There will also be the tenderness, more especially if you are trying to palpate the abdomen of this patient. There will be that feeling of tenderness and pain as you are palpating. And there can also be the progressive deterioration due to the erosion and wearing out of the pancreatic tissue due to the damage that can occur and leading to the pain that we have talked about. The diagnostic tests that can be of help. First thing, you can do the general one that we know, like history taking. The patient will be talking about having the pain in the epigastric region and other signs and symptoms like having nausea, having the history of vomiting. Through history taking, we can actually rule for the pancreatic rupture or the rupture of the pancreas. You can also do the physical examination whereby you are palpating, and as you are palpating the epigastric region, you see the patient actually reacting to it, or the tenderness of the patient. That is going to show that actually there could be the organ damage in the epigastric region. You can also do the CT scan. That is going to show the detailed structures or images of the ruptured pancreas. You can also do the abdominal ultrasound. That actually works with the waves that are going to detect the abnormality in the function of the pancreas. Also, X-ray can be of help, that can show the damage to the pancreas by using the images that are going to be produced by X-ray. And the management that is going to be done in this case, you're going to do the conservation treatment that can be commenced according to the degree of the injury. So this conservation treatment can be actually of maybe to remove the segment that is ruptured, or rather to repair the structure that has been ruptured by the kidney, if at all the degree of injury is not of that much that can easily be managed. Then surgery also can be done. The aim of surgery in this case will be to control the hemorrhage in an instance of the penetrating object that can lead to the pancreatic bleeding. So you are going to do surgery in order to arrest the bleeding and avoid hemorrhagic shock. Or removing the non-viable tissues. There can be the damaged tissues that can be of cause of the rupture. So for you to remove those damaged tissues that are non-viable, the surgery may call for attention. Also to preserve the viable tissues, to ensure that the tissues that are still alive of the pancreas are actually preserved, and to prevent them from dying or necrosis, surgery can also be done. And also to provide the drainage of the pancreatic secretion. For example, if I told there's a blockage in the ducts of the pancreas, to allow those contents like the pancreatic juice, so as to make the duct open and allow the secretion to drain into the duodenum. Surgery can call attention in this case. And we're saying that mostly the approach that is going to be used in the management of this pancreas, it is just similar to that of laparotomy surgery. Laparatory surgery, this is the procedure that is done just to explore and examine the organs of the abdomen. So the surgery that you're going to do in order to repair the pancreas, it is similar to this, because you are going to have an opening of the abdomen in order to manage the rupture of the pancreas. The second condition that you are going to talk about, or disorder that actually affects the pancreas, is the pancreatic cancer. Actually, when you're talking about the pancreatic cancer, in this case, you're dealing with the malignant neoplasm, or rather the abnormal overgrowth of the tissues of the pancreas due to some underlying conditions that may be present. And this actually originates from the transformed cells of the pancreas that becomes abnormal and be malignant to the pancreas. So the most common type of pancreatic cancer, it is said to be that of adenocarcinoma. So when you say adenocarcinoma, we are talking about the cancer of the glands. So being the pancreas has the gland for both exocrine and endocrine gland, you find that the glandular part of the pancreas is the one that is going to have the transformed cells, or overgrowth of the cells, leading to adenocarcinoma. But sometimes even the cells of the islet can also be manifest with the overgrowth or abnormal growth of these cells, leading to the type of cancer that we call neuroendocrine tumors. Neuroendocrine tumors, in this case, we are talking about the cells that are actually involved in the nervous system, or rather endocrine system. The signs and symptoms of the pancreatic cancer, in this case, he has said that most of the cases, just like it was with the rush of the kidney, the signs may not show. But as the time goes by, as this cancer is spreading, outside the pancreas, there are some of the possible signs and symptoms can actually manifest. And what are those signs and symptoms that we're talking about? In this case, you can actually see the jaundice. So in this case, bear in mind the relationship that we have already talked about, that is there between the pancreas and the biliary tree. So we're saying that jaundice actually is going to come in an instance whereby when the pancreatic duct gets to be blocked at the site where it joins with the biliary tree, which is at the uh, ampulla that we talked about initially. So when that ampulla gets to be blocked, it means that the bowel contents is not going to be distributed within the duodenum for the digestion to take place. As a result, jaundice, which is urine discoloration, the membranes like the eyes and the skin, it is going to show. And darker urine is also going to be one of the signs and symptoms. Due to the fact of the jaundice, it is going to increase the levels of bilirubin in the blood vessels, which is going to destroy the red blood cells, leading to the red discoloration or dark discoloration of the urine. Also, light colored or gray stool can be seen due to the fact that this bilirubin, when it is found within the digestive system, is going to give the color to the stool of that brown color. Now, to the fact that bilirubin is concentrated just in the bloodstream and is not found within the digestive system due to the blockage or the bowel duct, it is going to lead to the light colored stool that is going to be present in the GIT. And also itchy skin can result due to the irritation or the bilirubin that is found within the blood vessels or the skin. Hence the person will experience the itchiness of the skin. And also pain in the abdomen can also be seen, more especially if at all this cancer it is pressing or putting more pressure on other or nearby organs. This is going to result in pain. And weight loss can occur due to the fact that when these bowel contents are not being distributed in the digestive system, it can impair the digestive system, leading to loss of appetite, and poor appetite can eventually lead to weight loss. And just the obstruction that can be there in the pancreas, if at all it's the head of the pancreas that is occluded, you find that it will put more pressure on the stomach and resulting in the poor appetite and loss of weight, because also nausea and vomiting will be current, that will actually promote the weight loss that has already been talked about. Now, what could be the cause of this cancer of the pancreas? Remember, in general, we say this cause of the cancer, it is actually idiopathic. Even in this case, the cause of the pancreatic cancer, it is not primarily known. Or what we know, it is actually the predisposing factors, what influences the occurrence of this cancer. So the first predisposing factor is the family history. If at all this cancer runs in the families, there are high possibilities of an individual who belongs to this family of orientation to be found with the pancreatic cancer. Also age. As the person is advancing in age, there are actually abnormalities in the hormonal control and biochemicals that are running within the body, making the cells to actually to go abnormal in terms of their growth, leading to the pancreatic cancer. Smoking, cigarette smoking actually contains some chemicals or toxins that actually may impair the growth of the cell, leading to pancreatic cancer. And the diet that is low in vegetables, due to the imbalances of the electrolytes and the vitamins within the digestive system, you'll find that actually it is going to lead to the abnormal growth of the cells, leading to cancer of the pancreas. And the diet that is high in red meat, due to the presence of the oxalate in the meat, that can actually be of a positive influence to the occurrence of the pancreatic cancer. And the diet in high sugar sweetened drinks can also predispose a person to pancreatic cancer, in a sense that actually it's the pancreas that is essential in regulating the amount of sugars within the blood. So the high intake of this is going to actually impair the work of the islet cells that actually produces the insulin, leading to the cancer due to the abnormality. And the diabetes mellitus, the impact is just the same as that of high intake of sugar, because we find that the DM patient actually they have the failure of insulin production. So due to the increment in the sugar levels, it is going to alter the pancreas, and also failure of the insulin to be produced is going to result in the abnormal growth of the cells, leading to pancreatic cancer. Now we move on to talk about the exocrine pancreatic cancer that can be seen. So we're saying in this case we've got three types of cancer that can be seen in exocrine cancer, which is of course the adenocarcinoma, because we're talking about it being a gland. The first one, it is pancreatic intraepithelial neoplasm. Actually, this is the type of cancer that can only be seen by the use of the microscope, because it is just localized within the pancreas and the cells are still tiny to be seen. There's also intraductal papilla mucinous neoplasm. With this one, it is actually said to be the second most common type of exocrine pancreas cancer. Actually, it is the cancer or the ducts of the pancreas that actually invades the duct, and actually at the end of the day it may lead to the obstruction of this duct, which ends its pancreatic juice. And also have the mucinous cystic neoplasm. In this case we are talking about the macroscopic lesions. Macroscopic lesions are actually lesions that can easily be seen even without an aid of the microscope, so long you are in site of the pancreas. It's more like the overgrowth around the tissues or the pancreas that actually leads to the carcinomas that we are talking about. So these are the three types of exocrine pancreatic cancer: pancreatic intraepithelial neoplasm, intraductal papillary mucinous neoplasm, and mucinous cystic neoplasm. So this is what we have been talking about. These are the differential diagnosis, or rather the types of carcinomas that we have been talking about, exocrine carcinomas. So we can see the serous cystic adenoma. This is actually as the same as this one that we this type of carcinoma that we talked about, being the intraductal, no, not this one, but rather the mucinous cystic neoplasm. This is what we are saying. Then we also have the IPMN, which is the intraductal papillary mucinous neoplasm. And we also have mucinous cystic adenoma on this other side, and we can see the lesions that I were actually talking about. So these are some of the types of the carcinomas that can be found in the exocrine class of the pancreas. Investigations that can be done to arrive at the diagnosis of the cancer of the pancreas. There's actually, you can take the history from the patient of having reviewed those signs and symptoms that we talked about. The patient will still complain about the pain, nausea, and vomiting. You can also do the ultrasound or the abdomen, that is actually going to detect the waves by producing, it is going to produce the images by using the wave energy that is going to be directed on the abdomen. And you can also do the CT scan of the abdomen that can actually yield the detailed images or the lesions that can be seen on top or the surface of the pancreas. And full blood count can also be done to rule for the presence of an infection that can be the predisposing factor or the cause of the abnormal growth of the cells, which is cancer within the pancreas. You can also do the magnetic resonance imaging, that is actually the computer, it's more like the computer, but the machine that actually uses the takes the images or the damage, or rather the lesions or the cancer that can be seen on top or on the surface of the pancreas. You can also do the endoscopy ultrasound, that is the same as ultrasound or the abdomen, and also you can do the laparoscopy, which is actually the examining of the abdominal organs by using the imaging uh, means or methods that is going to show the lesions of the cancers of the pancreas. So those are the possible investigations that can be done. Then for you to treat this condition, you need to do the staging of the cancer. You need to identify at which stage is this cancer on. And the importance of you doing that, it is going to help you to know how much the tumor has grown. Is it still small, or it is large, is occupying the larger segment of this pancreas? Also, it is going to help you to see if at all it has spread to the lymph nodes. There are lymph nodes that are actually surrounding the structures within the body. So it is going to help you. Has it already been spread to the distant or the nearby lymph nodes, or has it metastasized? Has it been spread to the distant organs? In that, it helps you to determine the effective mode of treatment that you are going to put in place. That's why you need to stage. So now we are going to talk about different criteria on how we are going to stage this cancer. First thing, we are going to stage the cancer according to the primary tumor. We are also going to stage the cancer according to the spread to the lymph nodes, and we are going to stage the cancer according to its metastasis. So first thing, we are going to talk about the primary tumor. We are going to use the abbreviation T. We are going to be going by T, which denotes the tumor. So if at all the primary tumor cannot be assessed, so to speak, it is something that cannot be assessed, it is still at the stage that cannot be assessed, it is going to be abbreviated as TX. When it is T0, it means there is no evidence of the primary tumor. When it's T1, it is going to show that actually the tumors are still limited within the pancreas at the site of origin, so it is still localized. T1A, it is going to show that actually the cancer has been detected within the pancreas, but the lesion, it is still smaller, or 2 centimeters or smaller than that. Then when it's T1B, it is going to show that actually the detected lesion, it is more than 2 centimeters, but within the pancreas. When it is T2, it shows that actually the tumor penetrates to the duodenum, the bile duct, and the peripancreatic tissues, which are the structures that surrounds the pancreas. And when it is T3, in this case, it denotes that actually the tumor penetrates to the distant organs that are actually adjacent to this pancreas, or the organs of the abdomen. So in terms of the primary tumor, that's how we stage the cancer in this case. What about when it comes to the regional lymph nodes? If at all the lymph nodes have been also been affected, we are going to use the abbreviation N. So when it NX, it denotes that there are no lymph nodes, that the cancer cannot be assessed at the lymph nodes. And when it is N0, it means that there is no evidence of the regional lymph node metastasis. So that's how we are going to classify according to the lymph nodes. Then when it comes to the metastasis, we are going to use the abbreviation M with the suffix. So when it's MX, it means that the metastasis in this case cannot be assessed. But when it's M0, there is no evidence of the distant metastasis. And M1, it shows that actually there is a distant metastasis, since that the cancer can be detected in the distant organs apart that are away from the pancreas. And having staged the cancer, you can easily be able to come up with the possible and effective treatment. So what are the possible treatments that can be used? The first one is chemotherapy. Chemotherapy, it is actually the administration of the drug that can be said to be an aggressive treatment. that actually helps, that is being in use in treating the cancer cells, or to eradicate the presence of these cancer cells. So we're saying that it can be done when the resection, which is the removal of the lesions or the cancer at the pancreas, cannot be done. So we're saying that this is done when resection with curative surgery is not possible, which is, so when you say resection with curative surgery, we mean the removal of the lesions. So if at all this cannot be done, then chemotherapy can be put in place, and palliative chemotherapy may be used to improve the quality of life. Sometimes this chemotherapy can only be done just to improve the quality of life, but not primarily to cure the cancer, but to improve the quality. Another treatment is radiotherapy. Radiotherapy in this case is the use of radiations actually to kill or to eradicate the presence of the abnormal growth or the neoplasm. And with radiations, there are those that are said to be internal radiation and the external isotopes that can be used to treat the cancer cells. And surgery can also be done if at all these other treatment cannot be of help due to some indications. So we're saying that indications of pancreatic surgery can be if at all the cancer within is just within the pancreas, it has not yet been metastasized, because if it has already been spread to the distant cells, surgery can only induce its spread to other structures, and it cannot yield the effective results. And also surgery can be done if at all chemotherapy has failed to achieve the effectiveness of treatment. And radiotherapy has, if at all radiotherapy has failed or it is not indicated as one of the possible means of treatment. So we're saying that cancer is localized and considered suitable for surgery. So if at all cancer is localized, that's when surgery can be done, so as to ensure the effective functioning of the pancreas for both exocrine and the endocrine function units. The surgical interventions. The surgical interventions that can be put in place if at all is surgery that has to be done. The first procedure that can be done is a Whipple procedure. This Whipple procedure, we're saying that is the most attempted curative surgical treatment of cancer that involves the head of the pancreas, which actually involves the surgical removal of the pancreas. That's a Whipple procedure in this case. And in this procedure, it involves the removal of the pancreas, just like we have already said, at the cave of the duodenum, because that's where this pancreas actually joins with the digestive system. And most of the times you find that the pancreas and the duodenum, they are all going to be removed, making the procedure that is said to be pancreatoduodenectomy, which is the removal of the pancreas and the duodenum due to the fact of the cancer that can invade these two structures. And when this happens, the bypass will be done, whereby the remaining part of the stomach, it is going to be joined to the jejunum, forming what we call gastrojejunectomy, and attaching a loop of jejunum to the cystic duct to drain the bowel. So also the biliary tree, it is going to be joined at the site of the jejunum, because the duodenum in this case has been removed. And that attachment, or the cystic duct, or rather the bowel duct, to the jejunum, it is what we call cholecystojejunostomy. Cholecystojejunostomy. Okay, so this is the surgical intervention that can be done, and it can be performed only if the person can survive surgery, because there are instances whereby if surgery is going to be done when the metastasis has taken place, the person cannot actually survive. Hence, in such situations, the surgery cannot be done. But if at all the person can able to survive, the surgery can be done. And also this procedure can be done when the cancer where there's a cancer or the tail or the pancreas can also be resected using a procedure known as Dystopiatectomy. In this case, what we mean, if at all the cancer cells are localized or lesions are localized at the tail or the pancreas, whereby they are just going to do the resection of the pancreas, whereby they are going just to cut the invaded part, which we call the distal pancreatectomy. What are the possible complications if at all treatment has not been done or it was undertreated? If this cancer was undertreated or left untreated, there can be the severe weight loss, because we have seen the relationship with the digestive system. We can also have the bowel obstruction. When the duodenum it is obstructed, it means that the content from the stomach cannot run through the intestines, hence leading to the bowel obstruction. And also abdominal pain due to the fact of an inflammation that can be taking place in an instance whereby there is obstruction within the ducts, both the duodenum and the pancreas, maybe even be the biliary tree. And also we can have the liver failure due to the fact of the obstruction of the biliary tree, where the contents from the liver are not excreted or being distributed the duodenum. This can actually lead to the liver failure. But how can we prevent this occurrence of the cancer? Having seen that it doesn't have the cause, but quite alright, it has the predisposing factors. Our goal will be to fight against those predisposing factors. And what are those predisposing factors? For example, we talked about the smoking, which contains some toxins that can actually induce the overgrowth of the cells. Quitting smoking or the cessation of the smoking can actually be of help. Food, again, we can do the maintaining or the health weight. We have seen that actually high intake of sugar or glucose can lead to the cancer or the pancreas or overgrowth of the pancreas cells, due to the fact of the workload that is increased and the impairment in the islet cells. Hence, reducing the high intake, also exercising and taking the fruits and the vegetables diet. If we do that, at least it is going to help in the prevention of the uh, cancer of the pancreas. And also to choose the healthier diet, just like we have already mentioned. We've seen that high intake of red meat predisposes to the cancer, and also the deprivation of the fruits can also lead to cancer. Hence, to improve our diet or to improve the diet can be of health. If this implementation are put in place, it is going to actually yield the good results in terms of prevention the cancer of the pancreas. Friends, thank you very much. I guess this will be the end of our today's lesson. We were talking about the disorders that actually affects the cancer, or rather the pancreas, and we have seen two conditions, which is actually the rupture of the pancreas, and we have seen what can cause that, how we can diagnose, and the possible signs and symptoms. We have also talked about the cancer of the pancreas, where we have seen how this can be predisposed to, and actually we have seen the signs and symptoms that can be seen, the investigations that we can do, and the staging that we can actually take in place so as to come up with an effective therapeutic intervention, and also how this cancer can be managed and the possible complications that can arise if at all this cancer remains untreated or undertreated. And we have also talked about how this cancer can actually be prevented. For now, I'm saying thank you. Don't forget to subscribe and like the video. Thank you for your time and attention. Bye.